This is your Mentoring Minute, Critical Thinking and Test Taking, made for first-year Sem 1 college nursing students by second-year Sem 1 college nursing students. The most important aspect of taking any examination is to become knowledgeable about the subject matter the test will cover. There is no substitute for studying the material. A huge part of first semester is learning how to critically think. Critical thinking for a nursing exam is using the nursing process to identify the stem. What exactly is the question asking? There can be a positive truth, which the correct answer is accurately related to the statement, or a negative stem. Words such as except, not, never, contraindicated, further, unacceptable, least, avoid. These are things that you would not do. The correct answer are things that you would not do. There's also patients at risk. These are the A, B, C, D, E, F, and G risk categories. A is for age, B is for blindness or visual disturbances, C is for consciousness, D is for deafness or lack of hearing, E is for emotional, F is for frequency of accidents, and G is for gait or mobility. You'll find in a lot of Sem 1 college exams, the risk categories are either children or older adults. In studying, these are specific risk groups that you should pay attention to. You don't have to tell me that it is very frustrating that all the answers are correct and that you have to choose the best answer. So, do the answers provided match the questions asked? So if the question is asking you for an assessment, obviously the answer is going to be an assessment. If an intervention is listed, you can automatically rule that answer out. Also, does one of the answers include the ABCs or Maslow's hierarchy of needs? ABCs is airway, breathing, and circulation. This is for test taking, not to be confused with CPR. Maslow's hierarchy of needs includes physiologic, safety, love and belonging, esteem, and self-actualization. You're going to take care of somebody's physiological needs before their esteem or self-actualization. If they cannot breathe, you're not going to care about anything else. Identifying opposites are usually knowledge-based questions. You're going to have to know the answers to these and to rule out the other ones. That's just all there is to it. Identifying global options, or which answer is not like the others, or which answer is not the same. There's a lot of questions on exams when you go back to review that you can see that one answer is just totally different than the other answers listed. No matter what, avoid reading into the question. Never think, what if? You are in the NCLEX hospital, and what ifs never happen.
Okay, let's start with the first question. What should the nurse do immediately before performing any procedure? A, shut the door. B, wash their hands. C, close the curtain. Or D, drape the patient. Let's look at the stem of the question, immediately before performing any procedure. The key word here is immediately. The correct answer is B, wash their hands. Immediately is the key word in the stem. You would shut the door and close the curtain before you start the procedure. You would drape the patient after you wash your hands. Okay, next question. Which patient would be the greatest risk for an electrolyte imbalance? A, a child who is vomiting and has diarrhea. B, an athlete playing games on a hot summer day. C, a renal failure patient. Or D, a patient who is having nasogastric suctioning. This is a knowledge-based question. The answer identifies an at-risk category. You must comprehend this type of material.
The correct answer is a child who is vomiting and has diarrhea. The rationale being is that it's an at-risk category, the child. An athlete is at risk, a renal failure patient is at risk, and a patient who is having nasogastric suctioning is at risk. But the greatest risk is your risk category group, the child. The child is at risk because vomiting takes potassium out of your gut and diarrhea takes salt out of your butt. In Anne's words, acid from the gut, base from your butt. Those words will come in handy.
Next question. A patient who is undergoing cancer chemotherapy says to the nurse, "This is no way to live." Which response uses reflective technique? A. Tell me more about what you are thinking. B. You sound discouraged today. C. Life is not worth living. D. What are you saying? You must understand communication techniques in this question. This question is knowledge, comprehension, and analysis based. The correct answer is B. You sound discouraged today. I hope you would immediately rule out C and D. B is the correct answer because it attempts to identify and validate the feeling in the patient's message. A is incorrect. It is using the technique of clarification and asks the patient to expand on the message so that it becomes more understandable. This is not reflective. Next question. Which patient statement indicates a further need for teaching about vitamins? A. My need for vitamins will change as I get older. B. Some vitamins can be manufactured by the body. C. I don't need vitamins because I eat a balanced diet. Or D. Vitamins can be taken without the fear of toxic effects. This question is a negative STEM question. Only one of the answers is incorrect. The incorrect option is the answer. So the incorrect answer is D. Vitamins can be taken without fear of toxic effects. Mega doses of vitamins can result in toxicity. Next question. A patient reports being constipated. What should the nurse encourage the patient to eat? A. Fresh fruit and whole wheat bread. B. Whole wheat bread and chicken. C. Plain yogurt and fresh fruit. Or D. Chicken and plain yogurt.
The correct answer is fresh fruit and whole wheat bread. This is a knowledge-based question. We added this question in here to stress the importance of teaching in the nursing process. Educating your patient is a huge part of nursing, and it's going to be a huge part on the exams. This is also something else to be focused on when studying.
Okay, here's another good question. A nurse assesses that a postoperative patient has a decreased blood pressure and weak, thready pulse and concludes that the patient may be hemorrhaging. For what additional signs of hemorrhage should the nurse assess the patient? A. Pain. B. Respiration rate. C. Tachycardia. Or D. Fever.
The answer is C. Tachycardia. Pain is generally not associated with hemorrhage. Respiration rates may change postoperatively. This can be due to pain, anesthesia. There's lots of different reasons. There are many factors that can cause a fever. Generally, a low-grade fever is to be expected postoperatively. C is the best answer. An increased heart rate in addition to a decreased blood pressure and a weak, thready pulse is indicative of a hemorrhage.
So this next question is a really good priority question. The patient diagnosed with an exacerbation of COPD is in respiratory distress. Which intervention should the nurse implement first? A. Assist the patient in a sitting position at 90 degrees. B. Administer oxygen at 6 liters per minute via nasal cannula. C. Monitor vital signs with patient sitting upright. Or D. Notify the healthcare provider about the patient status.
The correct answer is A. Assist the patient into a sitting position at 90 degrees. This position decreases the work of breathing. When a question asks you to choose the intervention to implement first, you should select an intervention directly caring for the patient. Remember, in distress, do not assess. Administering oxygen would come after only assisting the patient into a sitting position. You would not monitor vital signs, that's part of your assessment, and notifying the healthcare provider would be passing the buck. You have to understand that in a lot of these questions, they're nursing questions. You're not going to notify the provider.
So our last question is one of my favorites. it's a select all that apply. You'll see that quite a bit on exams because it's used quite a bit in the NCLEX. Question is, the nurse writes a problem of impaired gas exchange for a patient diagnosed with cancer of the lung. Which intervention should be included in the plan of care? Select all that apply. 1. Apply O2 via nasal cannula. 2. Have the dietitian plan for 6 small meals a day. 3. Place the patient in respiratory isolation. 4. Assess vital signs for fever. And last, listen to lung sounds every shift. So the correct answers are number 1, apply O2 via nasal cannula. You want to place that patient on O2 to maintain their O2 saturation. You're going to have the patient see a dietitian, plan for 6 small meals a day. Patients with oxygenation issues often become fatigued during meals, so planning small ones is a really good idea. You would not place that patient in respiratory isolation. Cancer is not communicable, so there'd be no reason to place them in isolation. You would assess their vital signs for fever. Patients with cancer are at higher risk for developing infections due to impaired immunity. And you would listen to lung sounds, but you would do it more often than every shift. So that's an incorrect answer. So the correct answers are 1, 2, and 4.
We hope that you've enjoyed our tutorial of critical thinking and test taking and that it has helped you or will help you in the future. We thought that we should clarify that when an answer is listed that requires a doctor's order, you are to assume that you already have the order for that. So in the previous question about applying O2 via nasal cannula, you would assume that you have an order for oxygen, anything that is listed. You can verify that with our instructors. This is specific to Salmon College. I don't know what other people are doing out there, but that's what we're taught. We also have some other words for success. Attend class every day. Take notes and ask questions to clarify content that you're not familiar with. We have a handful of great instructors. There is not any of them there that I would not be comfortable with going and asking any question. They are totally willing and there to help. Buy a recorder and record the lectures. This will help you when reviewing the PowerPoints at home. Huge advocate for recording the lectures. I listen to them at least twice before every exam. I totally attribute that to me passing. Huge advocate for recording your lectures. Take a deep breath, read the questions, and identify the stem. Then read each answer. There's a handful of us that take a piece of paper, our scratch paper, hold it up on the screen above the answers, and just read the question. Just slow down, read, identify your stem, clarify what it's asking, and then one by one go through your answers so you can eliminate the ones that aren't relevant. It's totally going to help you to your thought process, slow down, eliminate answers. We wish you the best of luck in completing the program and hope you enjoy being a nurse. In full disclosure, all questions were taken out of these reference books. We highly recommend them for purchase.